The story of SMART is a story of several chapters. But in 20 plus years, the one thing we can guarantee ourselves is any technology that sits still is guaranteed to be dead in short order. The reason we are sitting with you, our partners, 20 years later, is because we have maintained a philosophy of dynamism. We have maintained fidelity to the ethos of this company, where the constant question has remained, what next? What's new? And that question has constantly been answered by all of you in this room. And today, in Africa, we face a continuing paradox. More technology than ever. AI is a new, huge conversation. Mobile platforms, data analytics, name it. Constantly facing new challenges. And anybody, whether in the public sector or in the private sector, who does not adapt will be left for dead. And you will suffer from persistent inefficiencies. We do know we operate in an environment with limited resources, but the efficient deployment of these resources can only be done on the backbone of technology. That is something we firmly believe in at SMART. The other thing we believe in is in demonstrating leadership in action. We firmly believe that the proof of the pudding is in the tasting. SMART today, as Harrison said, is in 12 African countries, serving over 2 million people through 9,000 plus healthcare facilities. And at a ballpark, at last count, every day, we process about 132 million worth of health claims for 50,000 patients. So if you let that sink in, our belief is in making an impact on three very important people in our ecosystem. Number one, the patient. Number two, the healthcare providers. And last but not least, the insurers or the schemes that serve the first two parties. And to bring all those two together, you have to be solving a problem for each one of those parties. The patient experience in the hospital experience with the patient and in settlement of claims with insurers or scheme managers, and for the scheme managers, the efficiency of the entire process. We found an environment when this business started where piles of paper were growing in all three of those segments. The patient had a pile of paper, the hospital had a mountain of paper, and the insurance company had the biggest mountain of all, because that's where all claims used to come and sit and marinate on a desk. And you will bear me witness, some of you who are here from the insurance sector, each of your offices had 2 to 3 floors with a couple of 100 people sifting through mountains of paper to determine should this claim be paid or should it not be paid. Am I right? Today, that is all being done through technology. The patient verification through technology, the treatment cycle through technology, the payment regulation through technology. And this is not the end of a journey, this is just where we are today. So for SMART, it is all about collaborative leadership, collaborating with you to build the next stage of this journey. And while we do so, we do it responsibly. Healthcare data is the most sensitive data you can handle anywhere today. So I leave you with a call to action. To our partners in the public sector, our government leaders led by the PS today, continue creating this enabling environment for growth. As a government, you lead policy, but you develop that policy together with players in the private sector. You lead us on standards of innovation. What are the minimums that are expected in an environment like ours? There are also global standards we comply with, but continue creating that enabling environment. To our minds, the government is very important in this journey because they create the highway. We have to be data compliant, we have to be healthcare standards compliant, along with many other statutory compliance levels. So to that leadership and partnership, my call to action is long may it continue. To our insurers and provider leaders, let's embrace interoperability. Let us embrace the new digital health superhighway, where patient data and records can move seamlessly from clinic to hospital to insurer. Let's prioritize the patient over our institutional silos, because it's all about the patient at the end of the day. And to our technology leaders, let's build for impact. Africa's health challenges are urgent. Solutions must be scalable, affordable, and designed for those who need them most. SMART has taken this well beyond this room, well beyond this continent, and our aspirations are to be a global leader in this field. Peers, we are not shy to say this because we come from a country that built M-Pesa. Global innovations that are recognized the world over. In healthcare, that technology will be built by SMART. Asanteni sana. Our slogan today is healthcare technology for a better world. A world where mothers will not carry tattered paper cards, where patients will not be turned away and discover that their insurer is not paying at the end of a very expensive and disturbed journey through a health institution, and where every single shilling meant for healthcare gets to where it deserves to be, the patient. Every single shilling. And this can be done at SHA level, it can be done at public hospital levels, it can be done at every single private hospital. So we welcome you to a day of very engaging discussions.